end federal funding for opioids, defund the drug dens, sue the opioid manufacturers and consulting companies who created this crisis. We will eliminate back office bureaucracy, and we will fund directly those people who need the help through groups that have success in delivering drug-free outcomes. And make no mistake, we will be shutting down drug dens. We will ban drug dens within 500 meters of schools, hospitals, daycares, playgrounds, and other places where the community is vulnerable. We will, let's be clear, these drug consumption sites do not work. And I'm going to quote the Lancet Commission study on this right now. There is no evidence that accessing a site lowers an individual's risk of fatal overdose over time, or that sites lower community overdose rates. We owe it to our fellow citizens who are still struggling with addiction to offer them a real chance to avoid adding to that terrible number of losses we've had already. We will expand access to recovery services with proven track records. These organizations, like the Oak Center in Winnipeg, or Harvest House in Ottawa and Atlantic Canada, or Last Store Recovery, Together We Can, Cedar Recovery. These organizations have proven track records. They will be the ones that get the funding. We will set up a different kind of funding model than you've ever seen before. Normally, governments receive applications that have all the right buzzwords, they fork over the check, and afterwards a report is written. And it doesn't matter what the outcome is as long as all the paperwork is done. That ends. Here's how we're going to run our drug recovery program. Organizations are going to be paid a set fee for the number of months they keep addicts drug-free. And they will be paid more for harder cases. So if someone is a casual drug user and trying to break the addiction before it becomes serious, the funding might not need to be as much. It could be 10 or 15 counseling sessions for that person. But on the other hand, if it's an extreme addiction with someone living on the street for multiple years and on the verge of dying, well, obviously more funding would be needed for that. But the funding will be paid to group organizations that successfully get people off drugs. Those organizations and interest groups who have been contributing to and complicit in the distribution of high-powered opioids and the harm production programs will be cut off, and they will be totally ineligible for any funding whatsoever. We need to break the addiction that these organizations have to keeping the crisis going. We're going to build it out based on the Alberta recovery model, which has shown a 40% reduction in the number of overdoses in 2023, more than 3 times what has happened in BC in that same time period. We will ensure that the Canadian people have hope that we can break the addiction and free our people from its grip.